Hey, happy, beautiful, amazing day. Dr. Bob Rakowski here out of Houston, Texas, with part 2 of 3 for demolishing diabetes. We're going to show enjoyable strategies that are backed by science and experience. And the best of all thing is that it works. So diabetes is the biggest problem in the world. It wasn't too long ago that they used to call juvenile onset diabetes type 1 and adult onset. Now is what they're calling type 2, but the fastest growing demographic of type 2 diabetics are actually children. So they can't call type 1 juvenile onset and the other adult onset anymore. Diabetes is the most expensive problem in the sick care system. It's even more expensive than cancer. And 1 in 7 sick care dollars are actually spent on diabetes. So when you start looking what insulin does, a lot of people think of sugar because that's the thing that rises in the blood that's critical, but it's also important for protein, and it's important for different types of ions, and it even creates fat. So if we don't have insulin, we actually waste away. And prior to the medical advancement of insulin for type 1 diabetics unfortunately would die. There's a very significant risk between increased blood sugar numbers and death risk. And from lowest risk to highest risk, the factor is over 20x. When we look at the complications of diabetes, there's blindness, kidney disease, nerve damage, amputation, heart disease, stroke, heart attack, loss of circulation, etc. And I've said for years, friends do not let friends become diabetic. And the great news is there's things that we can do about it. And one superfood is very, very powerful to resolve diabetes. A couple of cases. This is Pat. I first saw her 248 pounds, taking 8 drugs, and the doctors told her, dialysis is in your future. 9 months later, 38 pounds lighter, 0 drugs with perfect sugar. Well, we'll talk about some of the things we did to make that happen. And this gentleman's name was Travis. He was told, look, if you don't get your blood sugar under control, they're going to end up amputating your leg. So I took that picture day 1, and then this picture was just taken a week later. I probably should have had like a little sign on there that talked about the day, and maybe I should have the pulse ox on his toe there. But you can see, huge difference there. When we start talking about how diabetes happens, there's 4 things that happen, and I'm actually going to start with the liver. And the reason I start with the liver is the top diabetic drug in the world is for the liver. Then there's the pancreas with impaired insulin. Then there's the gut that's a problem. And then finally, the cells of the body don't take up the sugar like it should. So Harvard says that metformin is essentially the top diabetic drug for type 2 diabetes. They say it's tolerated well by most people. It's safe and effective. So how does it work? Well, metformin actually works on an enzyme right here called PEPCK, and it actually prevents the liver from making more sugar. My favorite superfood, Ganoderma, actually works on that same liver enzyme. And here's what I'll tell you. Metformin has a number of very undesirable side effects, pages of them, whereas Ganoderma has hundreds of desirable benefits. And metformin has a failure rate. They don't talk about that much in terms of diabetic drugs, but at 5 years, the failure rate of metformin, 21%. So what do? They add more drugs, different drugs. And there's a great chance with Ganoderma that diabetes can resolve. So type 2 diabetics have 5x the probability of non-alcoholic fatty liver. They actually start storing fat in areas of the body like the liver, the pancreas, the muscle that they probably shouldn't, or they definitely shouldn't under normal circumstances. And keep in mind, in some of these cases, this can lead to cirrhosis and even liver cancer. So interesting study here on the liver protective effects of Ganoderma for fatty liver, for liver cancer, for hepatitis B and other issues. So Ganoderma, really, really good for the liver. When we start talking about the pancreas, here's a study that shows that Ganoderma acts directly on the cells that make insulin and actually improve their ability to release insulin. And some fancy language here. I teach doctors, so I just took this right out of the study. It says it prevents apoptosis. That's actually death of the pancreatic beta cells. And it even enhances their regeneration. If we can keep those cells around longer, we can prevent type 2 diabetes. Ganoderma also protects the heart and body and liver from the negative effects of the standard American diet. So some of the things we see with diabetes are elevated total cholesterol, decreased good cholesterol, increased bad cholesterol, increased triglycerides. Well, Ganoderma protects all of those lipids and even modulates the bugs in the gut microbiome, which we're now beginning to realize are very, very important to our health. And finally, the way that people get insulin resistance is mostly through poor diet. It can also be stress and toxins and lack of exercise. But here, they even talk about the precise mechanisms by which Ganoderma can ameliorate or make better insulin resistance. So other studies, Ganoderma improves insulin resistance and reduces body fat. I like to show the PubMeds. You can type that into your Google search engine and see exactly the study if you're interested. And fascinatingly enough, this young lady lost 57 pounds in 10 months by just switching to a latte infused with Ganoderma, one of my favorite ways to consume it. And again, medical studies show that it's actually good for fat loss. I was at a conference in the early 1990s, and this Dr. Diana Schwartzbein, presented her data, which I found very fascinating about diabetes. And she basically said, you know what, the American Diabetic Association has it wrong. My patients who were engineers would measure their blood sugar before and after eating, and they came to realize that when they ate the American Diabetic Association diet, their diabetes got worse. And she said, we weren't taught this in medical school directly, but here's what we know. Insulin is outnumbered when it comes to blood sugar effects. Insulin's the only hormone that lowers blood sugar, but the three stress hormones, adrenaline, noradrenaline, and cortisol, all raise blood sugar to fight or flee. And then there's glucagon and growth hormones. So 5 against 1, you probably want to make sure that you're friendly to insulin and not disruptive to it. She also talked about the progression of bad blood sugar. And here's what she said. The first thing that rises is insulin because you're eating too many carbohydrates. Insulin says store fat, don't break down fat. So the second thing that rises is body fat. The third thing that rises is blood fat, elevated total cholesterol, decreased good cholesterol, increased bad cholesterol, increased triglycerides. And the fourth thing that rises is sugar. So probably the most significant thing here is if you're just looking at your sugar, you're missing the earlier markers of diabetes. And a simple fact, you cannot store fat without insulin. So if you're having excess fat, you likely had excess calories, excess carbohydrate, and excess insulin. Keep in mind that 90% of people with type 2 diabetes are overweight or are obese. And they've created a new term, diabesity. By the way, they also have globesity, meaning the whole world is getting there. But notice the progression, healthy body composition, then they go to belly fat. That ultimately leads to prediabetes, then to type 2 diabetes. So we might want to reverse that order. So the deadly quartet, I've talked about it before, stress, toxins, malnutrition, physical inactivity. All of these are related to type 2 diabetes. And we'll start with exercise because literally a single bout of exercise can reduce your blood sugar. So within your muscle cells are these things called exercise responsive GLUT4 vesicles. When you contract your muscles, these go to the surface of the cell and they can bring sugar into the muscle cell independent of insulin. So exercise and muscle contractions are certainly the friends of blood sugar. And by the way, the more powerfully that you contract the muscle, the more sugar is driven into the cell. When we start looking at diabetes and stress, stress is a major trigger of elevated blood sugar. And if your stress is elevated for a long period of time, then your blood sugar likely will be too. So the stress hormones, adrenaline, noradrenaline, and cortisol, also known as epinephrine, norepinephrine, and cortisol, all oppose the action of insulin. Very fascinating study, article by Joe Pizzorno, a naturopath, phenomenal physician, great author. And he said, you know what, if you look at the release of chemicals in our environment, and then you look at diabetes, they're basically the exact same graph. Now, he says within the article that association is not causation, but the data is definitely leaning in the direction that toxicity increases diabetes. So for my doctor friends, GGT, that stands for gamma glutamyl transferase. That's an enzyme that gets glutamine into cells to make glutathione, the primary detoxification agent inside of our cells. And we see as GGT rises, so does hemoglobin A1C, which represents the 120-day average of blood sugar. So there definitely seems to be a correlation. Malnutrition, the Global Nutrition Report 2020, malnutrition was the leading cause of death on planet Earth. And we know that processed foods are basically causing the problem. So how about this study? The more processed the food is, the lower its satiety potential. In other words, it doesn't satisfy you, lower nutrient density, it doesn't have in it what it needs to keep you healthy, and the higher its blood sugar impact. So do your best to stay away from processed foods. And when we look at 2020, 72% of Americans gained weight. So did they move themselves in a better state of health? No. And in fact, diabetes was a risk factor for problems with the virus. In the early 2000s, I lectured at a conference in Orlando, Florida. Barry Sears was the keynote speaker, and he put up a copy of what at the time was the USDA food pyramid. And he said, if ever there was a terrorist-like plot designed to destroy the health of the world, this would be it. So I literally created my own nutrition pyramid after that. Why do I call it nutrition pyramid? Because we know that food in and of itself does not have the nutrients in it that it once did. And by itself, it's not enough for optimal health. So at the base of the pyramid, we have food, then we have superfoods, then we have functional foods. There's plenty of functional foods I'll share with you that have Ganoderma, and that's what the medical literature suggested. Why don't we have that? Because that's great for blood sugar. A multivitamin, multimineral, activated omega-3s with resolvins, probiotics, and a combination of D3K2. The diet for diabetics, and probably a lot of other people too, is what I call keto and paleo. Leans, greens, nuts, and seeds is my memory aid. And another memory aid, if it's white, keep it out of sight. When I talk about diet, I tell people to eat real food, eat clean food, not too much, not too often. Why? Because calorie restriction and intermittent fasting are both mechanisms of longevity and anti-diabetic. Every color, every day. Why? Because the colors all have different nutrients in them in a way that honors your physiology, currently the way your chemistry is working, your genetics, what you got from your parents, and finally your body goals, mostly plants. And by the way, we are omnivores. We're not herbivores. We're not meant for exclusive plants. We're not carnivores. We're not meant for exclusive animal, but a hybrid type diet. Talk briefly about omega-3 resolvins, hundreds of studies now. Here's one on omega-3 resolvins and insulin sensitivity. This is the premium fish oil on the market, and literally resolvins just make things better. For people that have neuropathy, carnitine and lipoic acid and resveratrol are three very important things for neuropathy. And then finally, Ganoderma and diabetes, over 120 PubMed studies. Notice more and more in the most recent years. So Ganoderma improves insulin resistance and reduces body fat. That's going to be a great thing for diabetics. It is very powerful against the majority of the complications for diabetes. And it also is going to help the liver. It's going to help the pancreas. It's going to help insulin sensitivity, protects the body from the damaging effects of glucose, and is across the board a win. So what kind of Ganoderma you want? How about the highest quality? So I am an investor in a Ganoderma company that has USDA certified organic Ganoderma. By the way, this is what most of the competition is selling, and they can even call it organic, certified organic. Why? Because they didn't use herbicides, insecticides, fungicides, but this plant is too sick to reproduce. We actually have spores, the most powerful part of the plant, and that is one of the things that differentiates a great Ganoderma company from average. Some of our other quality certifications, and then a summary article about Ganoderma and its diabetic benefits. It improves carbohydrate digestion and metabolism. It's going to buffer the liver's production of glucose, protects against the diabetic liver and diabetic kidney. And this article suggests, well, why don't we have functional foods or functional beverages? So Frank here lost 100 pounds in 10 months drinking shakes that tasted like liquid birthday cake. We also have it available in coffee and tea and hot chocolate for kids because it's great for kids too. And you know what? I think you owe it to yourself to give it a try. And if you want some, reach out to me. Every Tuesday, I have an Ask the Doctor. We have an hour of wellness and questions, always a topic. And I'm always excited to share and answer questions. And this is going to wrap up Demolishing Diabetes Part 2 of 3. We will talk about diabetes type 3, which, by the way, Alzheimer's is considered a type 3 diabetes of the brain. As always, I'm Dr. Bob Rakowski, absolutely knowing that we can all be happy, healthy, and successful.